Welcome to Parallax by Ankur Kalra, a podcast produced by Radcliffe Cardiology to bring you a new angle of all things cardiology and the best from the US Cardiology Review. Published every second Monday, Ankur Kalra, MD, interventional cardiologist at the Cleveland Clinic in Ohio, USA, speaks with legendary cardiologists, reviews late-breaking trials, and interviews authors of our latest and best US Cardiology Review articles. We call them #audio articles. Parallax is the effect whereby the position or direction of an object appears to differ when viewed from different positions. So this podcast is your fix of reliable updates on all things cardiology by someone from a non-traditional background who is always looking at the industry from a new angle. Now, here's your host, Ankur Kalra, MD.
Hello, everyone. I hope everyone is healthy and safe. I know these are very trying times. I've used the term unprecedented in my recent episodes, and that is not an understatement, given the socioeconomic, political, and obviously health impact the pandemic has had on the world. A lot of our friends and families included. So I genuinely hope that everyone is following the instructions and staying healthy and safe. And thank you for doing your part. I think we as physicians are immensely grateful for individuals and people and families who've consciously made the decision to follow the instructions and, for the health and safety for everyone around us. With that having being said, I am very excited for today's guest. We've been trying to record this episode for several weeks, and because of her role that she has to fulfill, and just my own obligations as a clinician, it's been a struggle. But we're finally here. So my guest on the show today is Dr. Rosenbaum, Lisa Rosenbaum, someone who I have admired for a long time. I unfortunately never really got a chance to see her in person, even when I was in Boston. But Lisa, you've been extremely impactful in my journey as an author as well as a writer. But I should introduce you first. So Dr. Rosenbaum is a cardiologist at the Brigham and Women's Heart and Vascular Center. And she is just, this is going to be an extremely important introductory title. So just hold your breath, the audience and listeners. She is the national correspondent for the New England Journal of Medicine. The New England Journal of Medicine is arguably the most impactful journal in all of medicine and science. So Lisa, welcome and thank you for being on the show.
Thank you so much for having me.
So, no, it's our pleasure. And I'm glad to learn that you are healthy and safe. And I'm going to start the show by asking you the question of what inspired you to become a physician? What inspired you to pursue a career in medicine?
Oh, that question's easy for me. So my parents are both physicians. My dad is a rheumatologist and my mom is a cardiologist. And my dad has two brothers who are physicians, and I also have an aunt who's a physician, and then my grandfather was a physician. And so I think it was definitely sort of a way of life in my family. And it was very clear to me from an early age that it was just an immensely gratifying way to live and serve the world. And I definitely had a little detour in terms of thinking about also wanting to be a writer, but I always hoped to become a doctor.
Yeah, so there is a lot of resemblance, in our backgrounds. My father is a cardiologist. My cousin sister is a pediatric pulmonologist. Actually, my maternal grandfather was a family physician. And so, for my brother and I, who my brother is also a cardiologist. So for my brother and I, it was, like you said, it was a way of life.
Yeah.
And, like yourself, I actually had a detour as well into becoming an author and a writer, which
Wow.
I have actually managed to publish my first poetry book earlier this year.
Wow. Congratulations.
Thank you. So that is it's unarguable. It's an unarguable force if someone happens to be a physician in the family, in my opinion. What was it like, in your childhood? What sort of memories do you have, that sort of paved the pathway for you to pursue medicine?
Yeah, that's a great question. So I was extremely close to my grandfather, who also was a rheumatologist. And when I was, probably 5 or 6, he got laryngeal cancer. And he wrote a book about it called A Taste of My Own Medicine. And the book was made into the movie The Doctor, starring William Hurt. I think this was in 1992 or so. So just that experience alone was pretty formative, because he sort of became temporarily a famous doctor. And he had a practice in Portland, Oregon, with his own brother, who was a general surgeon, and then his son, and then nephew. And it was sort of in the center of Portland. And right next to his practice was a restaurant called Rose's Restaurant, which was actually owned by my great grandmother, who his wife's mother. And so he and his colleagues would eat lunch there every day. So I have a lot of memories of sort of hanging out at the restaurant, seeing all of them eating lunch, and then watching him sort of share this experience of, doctor to patient. So that was part of it. And then he and I were extremely close. And now my sister is an endocrinologist, my younger sister. But when I went to medical school, I was the first grandchild at that point. And so, you asked me specifically about childhood, so this is getting into medical school, so a little bit later, but he wanted to write a book together. I'll set that part aside. I think in terms of, my memories of my childhood are sort of my father is a physician scientist. So I just have these memories of him sort of, at the dining room table with just stacks and stacks of medical journals, and my mother, taking care of us and cooking, and then leaving to go take care of a patient who was having a STEMI, and then, coming back. But it was all it was a very happy childhood. All these memories are like, it was clear that my parents loved their work and they loved us, and neither got in the way of the other. And I think it just was also, I think when you see that, you realize, how gratifying work can be. And then I think when you go out into the community, so there's always this, we go to synagogue, or I'm at school, or I'm out, shopping with my mom, and we run into people who say, your grandfather took care of us for our whole lives, or, your father, saved my vision. And then all the time people would say to me, your mother, saved my husband's life. And that's incredibly powerful as a child.
Yes, you're right. I think so. Several aspects that you touched, which make childhood memories incredibly special, and just the way you described it very vividly. Thank you for doing that. Are some of the memories, I hope I could create for my kids.
Yeah.
But the memories are important, right? Because they even now, it's like an instant flashback, and they're so impressionable that you then decide to take on a similar career path, which obviously as physicians, we are privileged to touch several lives and impact lives and families and people in incredibly special ways. So it's truly a privilege to be able to do what we do. Let me ask you this. It might be a tough question to ask, but to answer. But I think just focusing on growing up in your childhood, was it more the memories from interactions you had with your father, or was it from your mother? Because you're the product of a dual physician household.
That's a funny question, only because my dad and I'd always ask my dad, who's smarter, you or mom? And he would say there are different kinds of smart. And I think that like the sort of the way I live my life is I'm very much a mix of both of them in terms of my personality. I mean, I chose my mom's field.
Yes.
But my dad is my dad is a scientist, and I'm not a scientist in any way. But I think that this impulse to sort of create or to publish, it probably I share with him a little bit. Although my mom is actually extremely creative. I always tell her, she's an incredible cook and she has an incredible eye, and so I see her when she when she makes a meal or when she decorates something, like her like the amount of thought and creativity that goes into it. When I see her do that, sometimes I think, oh, that's why, like, that impulse I share in terms of anything I write. But I don't know in terms of, which parent influenced me more. I mean, it's just it's impossible to answer those questions. They're such a team also.
Mm-hmm.
I think that like I like the pace of cardiology. There's no question about that. Like I like being in the hospital. I like taking care of really sick people. I like having to make very quick decisions. And so cardiology, and when I decided to do cardiology, I was just always sort of blown away by it. Even as a medical student, we had some lecture on cardiology the first day of medical school. I just remember getting goosebumps all over my body. It was like very visceral reaction. And I never felt any differently. But then I think as I went through training, I think what I found really exciting was that we had so much data to guide our practice. And then there's also this aspect that, is so behavioral. And I used to be a competitive runner. So I think back then it was more interesting to me that there was this behavioral aspect. Now it's not something that I've really incorporated into my career in terms of doing a lot of prevention or counseling around exercise and diet. But at the time it was interesting to me for that reason. And rheumatology is obviously so different. It's very cerebral. And again, my dad is he studies uveitis, and so inflammation of the eye. And so what he does is very, sub specialized, and he loves it. But I never developed sort of a specific scientific passion in either field. I mean, it was just always clear to me that what I loved taking care of patients, and I love to write. And I feel very lucky that I get to do both.
Yeah, so let's delve a little bit into the writing aspect of your career. When did that happen? And was that something you wanted to pursue from, once again, childhood, or was it early, like teenage years, or when you were in medical school? When did that mature?
Yeah, I do remember in high school, like loving having a paper to write, the process of it, like the process of sort of understanding that comes with writing, and sort of feeling that initial satisfaction. We had this international baccalaureate program in my high school, and so both the history classes and the English classes, required a lot of writing, and I found that immensely satisfying. But in college, I took a creative writing class on a whim, I think the fall of my junior year. And I started reading a lot of short stories, and then, obviously writing them because it was a fiction writing class. And I found it really thrilling and cathartic. And I also ended up making some incredible friends. And I think that, it was more social than anything else, but you realize how well you get to know people. I'd been doing pre-med, and then these huge classes with 300 people, and we're competing everybody for the best grade in the class. And it's kind of gross. And I wanted to get the science under my belt, but I didn't like that environment. And then suddenly it was this like very different environment where you're just like thinking about the world and what it means, and also developing these incredible friendships. And I loved that. And I loved the chance to create instead of just taking these multiple choice tests that it felt then, like your life depended on it. So I really loved that. And then I ended up actually, I've always been fascinated by mother-daughter relationships. I especially was then. And I had this group of like really wonderful and intense female friends. And we spent a lot of time, we were in college, so we were like figuring out who we were and sort of separating from our mothers in some ways. And so I wrote my thesis was like short stories about mothers and daughters. And so I had to take feminist studies in order to do that. But that's what I ended up doing. And I sort of loosely based it on several friends. And it was really, I found that project very fulfilling. It was almost like writing a book, and a themed book. And I had this amazing mentor. Her name's Elizabeth Talent. And I don't know, I learned a lot. And it became very clear to me then that, being able to create was sort of central to my happiness. But I never veered far from wanting to be a doctor. I did then though apply to get master's in fine arts programs. So I did end up going for 1 year right out of college to Columbia, and for an MFA in fiction writing. And I was at Stanford. So, I grew up in Portland, Oregon. So I'd always been on the West Coast. And then 2 weeks after I moved to New York, 9/11 happened. And it was, I've been thinking about it a lot because of Corona, just in terms of how hard it was to understand how horrible it was, how many people had died, the magnitude of tragedy. And so I thought I should write about it, but I didn't write about it very well. And again, it was fiction. It wasn't a nonfiction writing program. And I just sort of shut down that year. Like I think it was just an incredible, like it was right out of college. This horrible thing happened to the world. I didn't know how to think about it. And I spent most of my days wandering around Lower Manhattan. Like people posted all these pictures of people who had died. And that was like the only way I could figure out how to process the grief. And so I dropped out. And I think it became very clear to me then that like writing is great as an adjunct to something else, but that I needed to sort of be in the world doing something. And so I went to medical school the next year, and that was, well, it has its own challenges, but and I at first felt like I couldn't be creative, but at least I felt like I was on a path to doing what I loved. And that was true. But it was at that juncture that my grandfather, whom I mentioned, so by then he was in his 80s, and he'd had this incredible success with this first book that, was made into a movie. And when I started medical school, he had this idea that he was going to have this second book, but this book was one that we would write together, sort of a then and now about medicine and how it's changed. To do this, he started writing me all these letters about his experiences and asking me what I would do. And I actually never responded. Not because I loved him more than anything, but I was busy. And also I felt like I knew enough then from having written that, you needed like a structure, you needed themes, all these things. And I felt like the stories just didn't hang together in this way I ever knew how to move forward. But it was our bond. Like it was, a huge part of my life in this way, like between between us, like, we talked about it all the time. And every time I visited him, he was in Oregon. So, and I was at UCSF. And so, I flew home a lot to see him. And he just, the second I would walk in, he would say, like, sit down, I'm going to tell you a story, like, write it down. I mean, it was like this almost frenetic impulse to get them out. And he died, I think about a month before I finished residency, so in 2009. And he left me with these, he would send them in binders, and I have like these 2 volumes of stories and letters that he wrote me. And before Corona happened, actually, I was finally pulling them together to write this book, which hopefully I'll get back to if it seems like a reasonable thing to do after all of this, after the dust settles with this, if it settles.
Yes. No, thanks for taking us through that. Again,
that was a lot.
Yeah, no, it's great because, again, it's very detailed, it's vivid. I can almost picture you as a novelist, right? Because that's what, as someone has attention to detail and can vividly describe, distinct pivot points in life, which would then translate into a career path. I think you have it in you, the ingredients. In my opinion, you have it in you, the ingredients to be a very good, I think, writer, author, novelist. So, I'll probably take you up on that, just maybe garner a few lessons for myself, because I'm trying to finish my fiction novel, which, the poetry book was the prelude to what the fiction novel is about. It's set up in 286 BC, and my fiction novel, and it's the journey of a man, a prince, through love and war, and I wanted to. So the message, the overarching message for the novel is a spiritual one, and the chapters are based on the chapters of the holy text of the Bhagavad Gita. Is a text that I follow and I try to live my life by. And I just felt that in the modern, if that is even a word, I should probably say contemporary, because I think modern, some people call it into question. So maybe contemporary, in the contemporary world that we live in, I feel that some of the core messages of spirituality and complex human emotions have been lost or are lost, and I think I felt a strong need to be able to write a story which would somehow communicate that to our generation, and has been very cathartic for me personally. So I do resonate quite a bit with your sentiment of writing being cathartic.
Yeah.
I think there's definitely truth in there.
Yeah.
So no, well, I wish you. I definitely want, as someone who admires your work and your writing, I definitely want you to pursue that project. I think it's going to be worthwhile, and I think it's going to be very well perceived, because you're.
Thank you.
So getting to writing, because what I was saying was that your articles resonate very well with the readers, and it's not only me saying that. I mean, I've obviously seen the reaction on social media and Twitter, but I've also interacted with friends and colleagues who have read your work in the New England Journal of Medicine and are extremely fond of it. So I definitely think you have an established audience base already. So you should pursue that work. Which brings me to my next question. I think it's pretty cool. I think it's pretty cool to be the national correspondent of the New England Journal of Medicine. That's such a cool title to have. Like I'm envious of of that title. But how did that happen? I think it's phenomenal that you you are in that position, and your work, which you've done in that role, is incredible. So congratulations for everything. But you take us through the story of how that happened.
Okay, let me see. Also, sometimes I think there are others. I know we have an international correspondent, so I'm not the only one. I just want to make that clear. So let's see. I was a cardiology fellow, and I'm trying to remember when I first realized that at some point during my residency, I learned that the New England Journal had an editorial fellowship for a year. And then I matched for cardiology fellowship, I think before I actually knew that. And so I did the clinical training. And then after that,
Yes.
I did a 1-year editorial fellowship at the New England Journal. And it was a really special year in lots of ways. So first of all, it was the 200th anniversary year for the journal. And so they took 2 fellows that year. Now they take 2 or 3. We have 3 this year. That's normal. But at the time it wasn't as normal, I think. And so Daniela Lamas was my co-fellow. I don't know if you know her, but she's unbelievably talented. And she's a critical care doctor and also a writer. She's been writing a lot about COVID in the New York Times. And anyway, we were together, and it was just like really fun. She's just brilliant and funny, and we shared an office, and I learned a ton from her because she had been an editor, I think editor-in-chief at Harvard Crimson. And so she had this reporting background, which I totally didn't have. I had just done that, 1 year in creative writing and dropped out. And so that year was really formative for me for lots of reasons. It was, I learned a lot about writing from Daniela. And I also, it was in 2012. So it had been 11 years since I'd actually had time to just write and think. And, the first time I did it in 2001, I sort of fell apart. And so this time, though, with medical training under my belt, I really found it extremely gratifying again. And I found that I was able to structure my days around it, which, is one of the biggest challenges, I think, with writing is you have to be able to sort of, it's miserable in a lot of ways. And so you have to be able to figure out like how you can feel like your life has purpose and structure. But I did during that year. And so that was a big signal to me that maybe this was sort of worth pursuing. And the other part of it was just, it's incredible to be at the New England Journal. I think that was probably the best part. The editors are so smart and so thoughtful and so kind. And, I think that just being able to be sort of someone who got to listen into the conversations about science was really transformative for me. Until you're on the inside and you understand, you grasp sort of the thought that goes into decisions about what to publish and everything that surrounds that, it's hard to understand. But I think that, a couple things came out of it. One is that I wanted to write, but also that I really liked being part of this scientific endeavor. And I really liked thinking about questions around science, which ended up being a lot of what I write about. I wrote about conflicts of interest or the use of a vaccine or, ethics of trial design. These are all things that come up at the journal and tend to be topics that I find really fascinating to explore. And so I guess in terms of my career trajectory, that year was important because I got to know the editors and in particular, Jeff Drazen. And so by that time, he was editor-in-chief at the time. And so by that time, I had actually already matched for another fellowship, the Robert Wood Johnson Clinical Scholars Program. And so I did that thinking that actually maybe I still wanted a research career. And I was particularly interested in risk perception. And so I went to Penn, where they have incredible people who are doing work in behavioral economics. Kevin Volpe, David Ash were my mentors, and it was awesome to work with them. And they were doing this huge trial on improving medication adherence post-MI. And I did like a qualitative study within that where I just interviewed 30 people who'd had an MI and talked to them about how it felt to be taking medications. And when I went to publish the data, I found that all I wanted to do was tell these people's stories, and that I had gone through this whole sort of process of the IRB and all that stuff. And I was trying to make tables with the themes of the stories, and it felt like everything was lost in translation. And so that was like a huge moment for me in terms of, do I want to go down this path of sort of empirical work, or do I want to just be able to tell people's stories? And it turned out, the latter was true. And I ended up writing up the research, I say that in quotes, as an essay in the New England Journal. And after that, I ended up, I think, well, in the midst of that, I sort of offered myself to the New Yorker. It was after the ACA had been passed, and there was a lot of stuff happening with health policy, and we had a summer where we could do anything we wanted. And so I wrote to the online editor at the New Yorker and asked if I could come help with health content. And then when I was there, I started doing some writing for them for their online site. And I really got a kick out of that. I mean, for a million reasons, but it was just fun to be in the office, and it was fun to help them. And it was just a totally different environment than the New England Journal, but also totally awesome. And so basically the second year of that fellowship, I was just doing a lot of writing. And at that time, I wrote Jeff Drazen an email asking him for career advice, because there I was basically, a cardiologist who was writing, and I just felt like, who's going to want to hire me, really? Like, what? I don't know. It just seemed like a reach. And so I asked Jeff for advice, and then he said, let's talk tomorrow. And then we talked the next day, and he said, why don't you come write for us? And you can take an academic job anywhere you want. And I was like, completely surprised. I didn't think, it just never even crossed my mind that would be an option at all. And so I was like, yes, like that sounds amazing. And then, then it came, I had to figure out, where I wanted to be. And Jeff really encouraged me to interview at the Brigham. And, the Brigham is just a phenomenal place to be a cardiologist and a doctor. And I walked in to my interview that day, and again, I told you how I felt the first day of medical school when I started learning cardiology, the goosebump feeling, but it was very similar. I mean, I had read Braunwald's textbooks. My mom gave them to me when I was a medical student, and just the breadth and depth of talent in the division is it's still totally stunning to me. And I like the feeling of being around people who are just really smart and talented and pushing me. And so once I stepped in the door there, I felt like I didn't want to be anywhere else. And I still really feel that way about both places.
Yeah, it's like you work at the Brigham and Women's Hospital, and then you work in the New England Journal of Medicine. Like, I don't think there could be more intellectually stimulating places on the planet other than those two. And, you just happen to be there. So that's incredible. It really is.
Yeah, I feel extremely lucky. I mean, just deeply lucky every day, actually. And yeah, the sense of awe I feel for my colleagues never goes away. It probably only intensifies as I get to know them better and, understand their work. And as a writer, it's just incredibly, like, to be able to be around people who are, leading the field, or, just having unbelievable insights. Like, it's really fortunate.
Yeah, no, it truly is. So I resonate with your description of how special it was to be at the New England Journal of Medicine office. I was privy to one of the editorial board meetings on a Thursday afternoon. That's when it happened, right?
Oh, yeah. Wow.
So when I was a fellow at Beth Israel Deaconess Medical Center, I got interested. So I had to make a career decision of whether to pursue a year in structural heart interventions, learning how to do TAVRs, and MitraClips, or pursue pursue a year at the New England Journal of Medicine with the editorial fellowship. So I did apply. I went through a formal application process, and I was invited for an interview. So the interview pretty much was, trying to. So they had scheduled me to meet with the current fellow, which unfortunately I could not see her at the time. I think she was traveling from London. I think she was either a PhD at the School of Public Health and Tropical Hygiene in London, and she was in New York on an assignment. But I missed her, so they did pair me with a few of the associate editors, and it was just an incredible experience to interview with them, and then just to be able to have lunch with Jeff Drazen and John Jarko and all the other associate editors on a Thursday afternoon. And then because of the career trajectory that I wanted to pursue at the time, and also visa restrictions, that just didn't materialize. But part of me still feels that maybe one day, I even later in my career, like I would want to just take a sabbatical and go back and apply and and spend that year in the New England Journal of Medicine office. It's just is one of the things I really want to do, but I don't know if it'll ever happen. But that afternoon was incredibly special. Yes, it's on my bucket list of things to do. So one day, I don't know when, but hoping
I recommend it
hoping
if you can.
that moment will arrive in my life. So switching gears, and just trying to conclude the podcast by asking you about, and thank you for penning some really incredible articles from covering the story from Italy on COVID-19. What do you think about, so how have you processed the current situation, the COVID-19 pandemic, and where do you think we're headed in the near future? And also, there are going to be long-term implications of COVID-19, whether it's health or social or socioeconomic or political. These occurrences change the world. They really do. How do you process it? What do you think about it? And where do you think this is going to go?
So, I process it on two levels, emotionally and then intellectually. And emotionally, I would say I haven't processed it very well at all, insofar as I feel this diffuse grief and I don't know what to do with it. I think a lot of people feel that way, but it's just so many people have died. So many people's lives have been destroyed. I find it impossible to sort of fathom. Anytime I try to think about it, I just sort of feel paralyzed by it. And I think a lot of people feel that way. And I don't know how we as a collective are going to deal with that. But so that's my emotional reaction. As far as sort of what's going to happen, I feel compelled to say, obviously, I have no expertise in this. I what I know is from reading like you read and, reading the New York Times and Twitter, and then the reporting I've done, which doesn't really tell me what's going to happen. It's just more about what has happened. But it's very hard to see a way forward in this moment, given, the inadequacy of testing at this point. Clearly, we need to ramp that up so much more to be able to move toward opening society and protecting those who are vulnerable. And I have hope for a vaccine, but I have no sense of whether we'll get one ever, and if so, when. I think antibody testing will be hopefully helpful, but I don't think anyone yet knows whether those with antibodies will have enduring immunity. And I hope that we'll find treatments, but clearly there is not a lot yet that, suggests so much benefit that we could really any benefit actually that we could, safely open society and treat people who are sick. So I'm not feeling a lot of optimism. I wish I had something else to say.
It's been numbing and paralyzing, like you said, on many levels, on certainly the number of lives lost. And I was just talking to one of my colleagues about this. If you look at the number, it now almost equates to the number of lives lost due to influenza. But that number is an annual number, and what has happened with COVID-19 is that number has just been truncated into just lives lost within a matter of weeks, like several weeks. And that's what's really numbing and paralyzing about it. And to obviously read your coverage of what happened to our colleagues in Italy, and the memoirs coming out of New York City, and I have 5 friends who live in New York City and work as physicians in New York City, and they've sort of told me what's happened in New York, and it's very troubling. It's you sort of keep yourself in their shoes, and it's unfathomable, the amount of emotional turmoil and exhaustion that they have gone through or are going through. And I'm sure at a psychological level, this is going to have a life-lasting impact, on them, and how they think through medicine and practice medicine. And this is the calamity of our lifetime. And I hope that there isn't another pandemic in our lifetime, at least, or for that matter, ever. But it sort of is the way the nature works. There have been pandemics, and there are going to be pandemics, and I think, for me, the important lesson is a very important lesson in public health, and how important it is to take public health very seriously.
Yeah.
I was listening to Howard Buckner. I mean, he's come up with a fantastic series of podcasts for the JAMA network, and he's interviewed some really incredible people, and the take-home message is that United States in particular, or maybe the Western countries in particular, have gotten so good at infection prevention that public health was, it was never mainstream for many, many years, and generations of people came and left, and this was never really an occurrence in their lives. So they never really troubleshooted it or thought about it. But now that it's here, I think it's going to put public health back into the mainstream.
Yeah.
I hope.
Yeah, I hope so. I'm every day I search for silver linings, and I haven't found many yet.
Yes, no, it's these are just very strange and unusual circumstances. Well, Lisa, thank you so much for your time.
Thank you so much.
Dear cardiologists, we want to make this podcast about you and for you. So please email us your critical thoughts, comments and questions at podcast@radcliffe-group.com and visit uscjournal.com for more information. You can also follow us on Twitter, LinkedIn, Facebook and Instagram at Radcliffe Cardiology for daily updates. Join thousands of cardiologists and become a Radcliffean by registering to radcliffecardiology.com. You will receive regular newsletters and gain access to hundreds of expert interviews, educational webinars, clinical cases, and peer-reviewed articles from our 6 medical review journals on general cardiology, interventional cardiology, arrhythmia and electrophysiology, cardiac failure, and vascular and endovascular surgery. Thank you.